Hello, I am Dr. Jyoti Bajpai Dikshit. I am a genetic counselor at Karkinos Healthcare. Today, we are pleased to have Dr. Akhter Jawade, who is serving as Director of East at Karkinos Healthcare. Dr. Jawade is an experienced oncologist based in Kolkata, having trained in radiation oncology at the prestigious Institute of Postgraduate Medical Education and Research in Kolkata. He has worked with advanced cancer care technologies at Apollo hospitals in Kolkata and Mauritius. Dr. Jawade has treated patients from across eastern and northeastern India, as well as from Bangladesh, Bhutan, and Myanmar. At the community level, he has organized screening programs that have reached nearly 1 million people. Dr. Javed's work in clinical care and community outreach continues to make a meaningful impact on oncology. Welcome, Dr. Javed.
It's a pleasure to be here. Yeah.
Dr. Javed, we know that each cancer patient is unique. Hence, the requirements for detection, diagnosis, treatment planning, and physical, psychological, and nutritional wellness are also unique. We would like to ask you how healthcare providers can decode the unique needs of every patient to ensure a truly patient-centered approach during treatment.
Thank you, Dr. Jyoti. World Cancer Day's theme itself is united by unique. So your question becomes very relevant in that manner. A situation wherein the two patients come to me, okay, and I have not seen those patients earlier. They come to me. They have been seen earlier by my colleagues or my juniors and students. The students have not given me any of their personal details. I only know their clinical details. So from the clinical details, what I have seen is that both the patients have the same staging. If they have the same staging, we would try to do the same sort of treatment. So what we've done is we've given both the patient chemo and radiation. Now, having given the chemo and radiation, what I realized is at the end of the treatment, one patient has done very well and has been, the tumor has gone. But the second person, there's been a partial response. Now, I am very flabbergasted. Why should this happen? Because it should not have happened, because both the patients have the same treatment. So here comes the answer that every patient is very, very unique. It is not that all treatments given to the patients will work the same way. Every patient is unique, and this uniqueness is not only in the genetics of it. The uniqueness is also the patient's starting from the patient's, where the patient is coming from. So regionally, the culture of the patient, the social aspect of the patient, the financial aspect of the patient. So everything should be taken into account rather when we are treating this patient and when we see the results of this patient. That is why they are unique. They will have these different parameters. So this uniqueness is something which is very, very important to us, and we as clinicians should be able to understand that every patient is unique, and we have to treat each patient in the manner where we will be able to rather get the best clinical outcome from that treatment.
Thank you, Dr. Javed. So as you said, that the traditional way of one size fits all does not work now for cancer treatment, not just at genomic level or disease level, but also at various other levels. It is very important to understand and address these challenges to ensure equal access to care and support for all, regardless of where they live or what is their community. In our next question, we would like to learn from you, is patient care different across geographies and communities? How can the difference be addressed for effective patient care?
So no doctor would want to treat a patient in a partial manner. Every doctor, every cancer specialist would want a good clinical outcome. Okay. Having said that, we need to have that infrastructure, everything available to treat a patient in a proper manner. right? So, which is not available. Nowadays, most of the cancer hospitals or most of the cancer setups, comprehensive cancer setups, are in big cities. India being mostly a rural country, so people have to travel long distances. We have to take everything into account. Along with that, their eating habits, the food habits, various habits of theirs. Okay, so the cultural aspect has to be kept in mind, and also psychosocial. Okay, the psychological aspect, that is something which is very, very important. And a patient who is psychologically fit will endure the treatment much better than a patient who is psychologically, who is a bit depressed. So the knowledge dissemination is also very important, wherein, people should be aware, even to the last person in the village, should be aware that these are the basic symptoms which a person of cancer patients can have. So they should get themselves at least checked. So screening. So we are doing a lot of screening camps. We are reaching out, as I said, we did the maximum, one of the maximum screenings we did, recently. We've reached nearly 1 million people. And that is not a small amount. The vulnerable section of the society, which is the most affected. This is sad. This is the sad part of it too. Even though they stay in the city, they are unable to pay. So we are taking the initiatives to go and do the screening there and directing. So the care continuum should be maintained. Just screening and diagnosing a patient would not help. We have to ensure that this patient is taken and treated also. We also have to take the modern technologies into account. It is not only this, the modern technologies, so that we are able to look into the genetic profiling of the patient. We have realized that cancer is a genetic disease where there is a mutation which actually leads to ultimately cancer. That aspect also has to be taken into account, and we have to treat accordingly, taking all these factors along with these important investigative measures which we have taken, and tailor our treatment in such a way that the patient gets the best treatment. Now what we are going is accessible and affordable cancer care, which is very, very important. Accessible care. Patients, we should go out to the patients rather than patients coming to us. We should be going out. So there should be cancer centers across India. There should be cancer centers where patients can come and get treated and go back in the same day. This is something which is rare. So accessible, affordable cancer care is costly. There is no doubt about that. But the government is coming forward. There are various social organizations which are coming forward to help the patient get treated. So affordability and accessibility are very important aspects in this part. I have seen patients coming from Northeast. So Northeast patients with the same stage and a patient of Bengal with the same stage, if both are given the same treatment, the Northeast patient responds very well. When we can pinpoint on the genetic profiling that this particular gene or this particular mutation is causing, so we can target that, and we can target that particular area. It could be either through radiotherapy, it could either be through chemotherapy, and this is what we call precision therapy, precision oncology, or targeted therapies. It has to be a combination of both accessible, affordable care with precision oncology available. If we can do that, we will defeat cancer.
Dr. Javed, your thoughts on cancer care at individual level and at community level have guided us, making it clear that each cancer patient's journey is unique, yet we are all united by the shared goal of providing better care and support to all the cancer patients. Thank you for joining us and enlightening us on how to provide equal access to affordable, accessible, and available cancer care for everyone by being united by unique. Thank you very much.